before we go on to talk about treatment goals versus patient expectations, are you running clinical trials at the moment in your centre with drugs other than Spinraza?
We are participating in clinical research for one of the newer therapies for spinal muscular atrophy that is looking at a cocktail combination approach for patients who have received SMN upregulating therapies like Spinraza to use along with that something that's called SRK-015, which is being made by a company called Scholar Rock, looking at stabilizing that muscle membrane.
Now, talking about patient expectation, obviously you've set a very rosy picture of the fact that most patients who've had these treatments do respond, and it's almost expected that they're going to do extremely well, and that the outcome is good, and you have this ongoing maintenance therapy and very objective milestones that you can measure. How do you have that conversation about patient expectations to give them hope, but also be realistic about the treatment options and what to expect, both short-term and long-term?
So I think it's important to recognize that Sebastian is actually quite rare in the level of strength that he has with his diagnosis. He's able to walk. He has independently accomplished, graduating from college and holding down a job and driving a car. And I'm hopeful that with treatment that will continue. So many of my patients have significant physical disabilities. And so you're right, setting the stage for those expectations. If you've been in a power wheelchair for 20 years, I don't know that this therapy is going to be able to have you leave that power wheelchair because you've already lost a certain degree of motor neurons that may not be able to be recoverable. And so we have an honest and open dialogue about what our hopes are and what our expectations are. And you'd be surprised, or maybe not, at the level of realism that my patients have, that they recognize that there are some limitations to some of the things that they may be able to accomplish even with therapy. But as long as we can identify what their goals of treatment are, then I can say whether or not I think those are realistic goals of treatment, and usually they are.
Mm-hmm. And you've talked about how well Sebastian's done. Do you think that's because of the severity of his type of SMA for his age, or is it just because he's on the younger end, at 23, getting treatment, the outcome one would expect would be much more optimistic than somebody who's getting the same treatment at 43, 53, for example?
My patients who are making it to age 23 and 43 and 65 do tend to have the milder phenotype. And so they've already started from a level that is stronger than some of my patients who were diagnosed at a young age because of more profound weakness. So you're right, I do think it's more based in the genetic characterization of his disease.
Two final questions. We hear so much about these rare diseases and also cancer that patients want to know what else is out there other than the conventional treatments. Do you get a lot of questions about holistic therapies or vitamins, supplements, any other integrative medical treatments that have been discussed?
Yes, his parents asked me about that when we met. So vitamin D is certainly something that's helpful, and that's something that I try and encourage all of my patients to take in order to optimize bone health. We know that bone health in our patients with neuromuscular diseases is impaired because bone health is at least in part due to the force on those bones, which is given to you by muscle and nerve. And so, optimizing bone health through things like vitamin D and calcium can be helpful. From a genetic perspective, there is not necessarily a supplement that's going to help upregulate your SMN production. And so, apart from optimizing nutrition and weight, and optimizing your bone health from a supplemental perspective, there's not a whole lot in the way of other supplements or things that I would traditionally recommend.